I'm Dr. Ryan Stanton, and it's time to find out what's going around. This week, I have seen several episodes of GI bleeding. I see cases year-round, but a recent flurry of cases reminded me that we should talk about it here. GI bleeding is a blanket description of any bleeding within the GI tract, including the esophagus, stomach, small bowel, and large bowel. These cases can be anything from just a little bit of blood to life-threatening hemorrhage. The most common causes are stomach ulcers, diverticulosis, masses, and hemorrhoids. In younger folks, other than hemorrhoids, peptic ulcer disease is one of the more likely culprits. This can be caused by a bacteria called Helicobacter pylori, as well as medications. In fact, one of the most common I see in the ED is from the chronic or frequent use of NSAID medications for pain, such as ibuprofen, naproxen, and others. These are best managed by a cessation of the medication and other treatments that can be guided by a GI doctor or your primary care physician. In older adults, the lower GI tract takes center stage in most cases with diverticulosis, cancer, and hemorrhoids. With the growing elderly population, we're seeing more and more of the population on anticoagulant medications used to help treat and prevent cardiovascular associated diseases. This does increase the risk of GI bleeding and also hinders the resolution. This bleeding can be characterized with dark, tarry stools called melena, all the way up to major bleeding with clots. When you notice blood for the first time, it's important to get checked out. If it's minor, this can be done with your primary care physician. But if significant bleeding is there, more urgent evaluation is indicated. In the emergency department, we check for blood in the stool, blood levels, and a good history and physical exam to try and identify the source. Most cases go home with medications and referral to gastroenterology. On occasion, though, admission and interventions in the hospital may be necessary. You can join the conversation on Facebook at our What's Going Around page as well as the StantonMD page. Also follow at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and that's What's Going Around.